Ladies and gentlemen, Tracy Niesent.
Thank you. Can you hear me? Can everybody hear me?
Yes.
Can you hear me now? Yeah. Today I'm going to talk about the phenomena called sleep paralysis and how it actually can be mistaken many times for paranormal activity. I'm going to give a brief 15-minute presentation on what sleep paralysis actually is. And then I'm going to open it up to discussion so any of you can share any experience you might have had with it or clients who might have been suffering with this. So now I'm going to begin. What is sleep paralysis? It's a condition in which a person, usually lying on their back, is about to fall asleep or has just awoken to find themselves incapable of movement or speech. It's usually accompanied by hypnagogic prior to sleep or hypnopompic after awaking hallucinations. It's characterized by feelings of fear or panic. It's not a dangerous condition, but is sometimes associated with narcolepsy. And it can last up to 8 minutes after symptoms come on. And I get sleep paralysis all the time, so I guess I can be considered kind of a personal expert on the subject. And the causes, it's a result of premature or persistent mind-body disconnection as one is about to enter or exit REM sleep. During REM, the sleep hormones are secreted to paralyze the body to prevent the acting out of our dreams. Normally, the hormones wear off before the dreaming ends, and the person awakens with full functioning. But with sleep paralysis, the hormones are still actively restraining the motor functions and muscle groups of the body. Incident increases with sleep deprivation, stress, irregular sleeping schedules, sleeping on the back, bipolar disorder, and certain medications such as Xanax and Valium. Symptoms, inability to move, hearing high-pitched ringing, banging, or loud noises, and sometimes voices, odd bodily sensations such as vibrations and tremors, feelings of flying or floating, or feelings that the body is being twisted, compressed, or rotated. It can also present with physical pain in various parts of the body. And there's usually the sense of being watched or being attacked by an evil or malevolent presence. And there's always a sense of impending doom or death, and sometimes people can get odd smells. It can affect up to as many as 4 out of 10 people. First noticed in the teen years, but can occur in people of all ages. Occurrences decrease in frequency with age, and onset is rare after age 30. It can be hereditary and run in families. Medical terms for it are waking paralysis, predormital paralysis before sleep, and postdormital paralysis after sleep, and of course the REM sleep, atonia. As far as what people experience, it goes by culture. I gave a couple examples. For Americans, I think they get assaulted by aliens, the devil or demons. Europeans by ghosts, Africans by demons, Southeast Asians by evil spirits, and of course the common old hag. How it might relate to the paranormal, it's most often responsible for mistaken reports of paranormal activity, often accompanied by the sense of an invading presence, which is a hypnopompic hallucination. People may feel, smell, hear, or see a presence with them that takes on the form of a supernatural entity specific to their culture. The presence seems real and may even get into bed with the victim and assault them. People experience a heavy tightness in the chest area that is often described as feeling as though a heavy weight is on their chest or that they're being strangled. It's often mistaken for an out-of-body experience, alien abduction, ghost sighting. Like I said, it's caused by the dream state invading the waking world, producing hallucinations through all of the senses. The brain can also misinterpret signals coming from the senses and cause the hallucinations. And I found this interesting. The chances of seeing a ghost is greatly enhanced by sitting or lying down in a relaxed state. Conclusions, I just put questions to ask the clients to determine sleep paralysis. Were you in a relaxed or meditative state when you noticed the occurrences? Prior to experiencing the activity, were you dreaming? Did you notice any unusual body sensations before the occurrences? And were the occurrences associated with falling asleep or waking up? And are you familiar with sleep paralysis and its associated symptoms that can mimic paranormal activity? And that's pretty much it now. Discussion. Anybody have any questions? Answer? Yes, sir.
Yeah, I've had problems. I would fall asleep and I would sleep on my stomach and sleep on the side. But I had waken up to where I feel as though I've got a lot of heavy weight on me, and I'm like, there's no way I can move to get up. And this is either when I sleep on my stomach or on my side. It's happened. I mean, it hasn't happened for quite a few years, but where I was living before, it was always happening. I would, 2-3 times a week, I would wake up and I was like, feel like I got somebody sitting on me and stuff. And I moved out of there and I moved, but it hasn't happened since.
Nobody really knows. I mean, it could possibly be paranormal phenomena. It's just not all that well studied. But it's something that happens to a lot of the population. Me personally, when I get the sleep paralysis, I use it to launch in what they call a lucid dream. And those are awesome. And a lot of people are actually trying to induce that sleep paralysis state. And for you, if it ever happens again, just sit with it and see where it'll take you, because you might have some very wonderful lucid experiences with that. You're welcome. Anybody else?
I'm wondering about what's the possibility of that explaining any people, alien abduction kind of thing, or near-death experience, particularly you see some icon of your culture. I mean, I've experienced the alien abduction. I wouldn't really call it an alien abduction, but as I was going through the sleep paralysis, I saw in the corner of my room there were 2 beings, and it felt like my essence or whatever was just being sucked out of me. It was really, really strange. But I was able to not give into the fear and, take it into a lucid dream. But, I mean, I did a lot of research, and scientists aren't even really sure, what causes it.
Just, we always tell our people when we do investigations, whenever you meet with a client, if you're doing a prelim or you're doing an investigation, so they tell you something like that, red flags have to go up. And we tell all our people, make sure those red flags go up, because a lot of those things are sleep paralysis and not necessarily a haunting. So, just, keep that in mind. But, just what you were talking about was a classic case of, what people have talked about, pressure on the chest, can't get up, feeling of wanting to scream but you can't scream, and next thing you know, you wake up and your eyes are open, and you're back in your surroundings.
Well, see, I was awake. I'm lying there with my eyes open. It's like I can't move.
Right, and that's typical of sleep paralysis. But a lot of people associate that. They may have a legitimate haunting in their house, but they also try to associate that, and it becomes more of a coincidental type haunting, and they try to put that along with the haunting, especially if you're doing it. You just kind of want to, let them know, okay, don't say right out, oh, that wasn't a haunting. You didn't see a ghost while you were sleeping. Just kind of put that in the back of your head. Okay, that's a possibility of sleep paralysis.
One thing is, I do notice that people that did live in the house, and we had died in the house, when we were living in it, my friend, her mother had passed away. And I never really I didn't know what to do. That but it just really had me scared to know that, I can't move. What's going on? I never explained it.
Yeah.
And so I don't know what the heck, I didn't know what would ever cause it. But like I said, once I moved out of here, I've never had that happen again.
Hey, you had a question from Honey?
Yes. Well, I just wanted to point out that as investigators, a lot of our cases, what do you hear? I was sleeping and I woke up and there was a ghost standing next to me. I felt like something was holding me down. How many times have we heard that as investigators? So you have to take into, and I've had those dreams myself, where I've been paralyzed, demons were getting me, I mean, ghosts were getting me, I dream a lot about ghosts, as a ghost hunter, but, and I have those dreams where you feel like you're coming down, and that's a normal psychological occurrence.
It's scary.
You have to take that into consideration, and they may be having haunting happen in their home, but at the same time, that can trigger these dream states where they're experiencing sleep paralysis. So you can't chalk it up to being part of a haunting. I'm trying to explain sleep paralysis, the effects of it, and not consider everything is not a ghost. And people will start to believe that when they live in a haunted house, they have one experience that they associate everything with.
That's why I asked them where's the feedback. We have 4 wireless next to me.
Yes, ma'am?
You can't hear them. They're saying that they can't use their
Yeah. Yeah. Like I used it. Yeah, that's exactly what it is.
Sometimes it seems kind of real though. And that's what
It
scares a
seems
lot.
very real. I mean, when it happens, very, very real.
Hey, anybody else? Any opinions? Anything? Oh, weird.
Question, how do you know if it isn't necessarily associated with some paranormal phenomenon? I mean, when we're in a REM state, our brain is more active. Isn't it possible that we are able to see things that we might not be able to see with our waking eye?
Yeah, anything's possible. Like I said, they know somewhat the physiology of it, and that it's really common. But yeah, like you said, who's to say it's not making us more receptive to the paranormal? And unfortunately, I don't think we'll ever know. You will? Yes.
Now, is it something that occurs once in a while? I mean, when somebody has it, are they likely to have it more often, or is it just like one or two time occurrence?
Usually people tend to have it more than once. I know myself, I get it about maybe 15, 20 times a night or a month.
Wow.
And then that's how I use it to go into the lucid dreaming. But for me, it started when I was in my early 20s, like 2019, somewhere around there. And it actually started out very, very frightening with all the old hags and demons and everything. But now, it's not so much that anymore. I just sit through the sensations, and then if you can keep your mind awake, you'll go into a dream, and you'll be aware. And it's really kind of fascinating.
Question too, in regards to distinguishing paranormal activity, would you say it's best if there was a certain time frame? You know what I mean? Like they're in the house, they're experiencing other things while they're awake, and then they have this occurrence once or twice. Would you actually call it sleep paralysis, or would you look into it as paranormal activity?
You would always look into it as paranormal activity. Rule out everything you can, and then
Right.
you're left with the obvious.
Yeah. Thank you.
Okay. Anybody else?
Real quick, before you guys continue, please turn off your cell phones. You can.
Tracy, we did research years ago about visitation type hauntings, and there are some people that have been asleep, they've had dreams about somebody passing away, and then next thing you know it, they get that call in the morning or later on that afternoon that person has passed away. You get a lot of that.
Yeah, I've never experienced anything personally like
So
that.
would that be more of a premonition? Or?
That would be a premonition, yeah.
Okay.
Yeah, definitely. Which I have, in the research, I have heard of that happening quite often. And I actually belong to a couple message boards that talk about sleep paralysis and lucid dreaming. And I mean, it's universal. Everybody experiences the same thing. I mean, as far as the physiologic effects and the frightening aspects of it as well.
Well, that's an interesting topic. Does anybody else have anything for Tracy? Okay. This is a very participative Florida Ghost Gathering. This is where you come in and speak your mind, share your opinion.
Let me speak up a little bit. Do you know of any deaths that occurred from sleep paralysis?
No, it can't kill you. You may think you're going to die, but nothing can kill you.
And if you don't wake up, then you're dead.
Then you're dead.
Well, we have clients that have asked that.
Yes.
Okay, so when you're dealing with a client who, I mean, some people, like, they may be going through sleep paralysis and not necessarily having a paranormal occurrence. However, some people, it could just be because, like, now, I wouldn't say that this is a fad by any means, but, like, it's becoming more accepted in the community.
Yeah.
And they just don't want to accept that it's an actual, like, medical situation. I mean, how would you go about dealing with trying to explain this to somebody without making them feel stupid or making them feel like they're crazy, but like also trying to get them kind of back into, you know, reality and letting them know that this isn't necessarily paranormal, and or if it is paranormal, I mean, what do? Do you just have them like set up a camera in their room and just like, we'll see what happens?
Yeah, you can do that too, but what we usually do is just reiterate, you know, the symptoms of the sleep paralysis and just validate the client that, you know, what you're experiencing is real. We just don't exactly know what it is. We can investigate, you know, the haunting to see if we get evidence, but really the camera would probably be the best bet in their room. Yes?
Tracy.
Would you say, well, the question I really want to know is, let's see if I can get it formulated in my head the way I want to say. Is sleep paralysis, is it more prominent on someone that might be taking medication versus someone that doesn't take any medication?
Yeah, like I had in there, like it said the medications like Valium and Xanax, so any kind of mood altering drugs could definitely cause that.
Also the TV. If you sleep with the TV on or a radio on, there's a good chance you'll have sleep paralysis. Just because you know you may be asleep, but you know your brain's and you're still picking things up. EMF, yeah. High EMF?
Yeah, very much so.
Room 218. No, 118. Right?
Yeah, 118, yeah.
Now, what if you're more of a sensitive, I mean, for being a sensitive medium, are you more open to it? You know, just because you feel other things, you know, that are happening. And at that stage, are you more in tune with it that you're going to go for this? You see what I'm saying?
Yeah, I see what you're saying. I mean, yeah, anything is possible. I'm not psychic myself or sensitive, so I can't really, you know, go by what, you know, they might be feeling because I have no personal reference. But, I mean, logically, it would seem that they could experience that, yeah. Yeah.
She has to have some sort of like, otherwise she can't.
I haven't found much research in that area. Yeah.
I did that research last night with pizza and alcohol. Yeah. I don't want to discuss this without.
Happened to me when I was in Connecticut, but I did have paranormal.
Any other questions? Let's just say it's probably going to happen again. Anybody else? All right, Tracy, thank you. Very informative.